నమస్కారం. డాక్టర్ బిఆర్ అంబేద్కర్ సార్వత్రిక విశ్వవిద్యాలయం విద్యార్థులకు స్వాగతం. ఈ ప్రసారంలో డిగ్రీ విద్యార్థుల కోసం జంతుశాస్త్రం నుండి పాఠం ప్రసారమవుతుంది. శీర్షిక జెనెటిక్ డిసీజెస్. చూడండి.
This program is to catalogue some of the interesting inheritable disorders of human beings. This topic you will find in course 3 of BSc Zoology program. By the end of this lesson, you will be able to understand what are genetic diseases, what are the chromosomes and genes, and how many types of genetic diseases, diagnosis and management of genetic diseases. Human beings naturally are more interested in their own inheritance. The gene information about man in earlier days was obtained from the studies of pedigree histories. The study of a particular character in the family members has given a clue to the inheritance of that particular gene which is responsible for that particular disease. Many studies on human population indicated that there are more than 200 genetic diseases are reported in human beings. What are these genetic diseases? How it will occur? The genetic diseases are also known as hereditary diseases. These will occur due to the interaction of abnormal genes and the environment. These are the most burdensome of all the human afflictions. These will determine at the conception level and it can express at any time in the life. So far in this lesson, you have studied the genes are responsible for the genetic diseases. What are these genes? Human body consists of number of cells which are also known as units of life. All these cells possess a material known as chromatin in its nucleus. The chromatin is fiber-like structure and forms a network in the nucleus, and this chromatin is made up of deoxyribonucleic acid or DNA. The genes are the units on DNA which are responsible for the expression of the characters in the organisms. During the cell division, this chromatin organizes to form a rod-like structures known as chromosomes. The number of the chromosomes varies from one organism to the other organism. In human beings, the number of the chromosomes are 46, and this will occur in pairs, one derived from each parent. Out of these 46 chromosomes, 44 or 22 pairs of chromosomes are called autosomes, and the remaining one pair are called sex chromosomes. The sex chromosomes determine the sex of the individual. In males, the sex chromosomes are X and Y, and in the females, these are X and X. Any possible error in the meiosis or during the cell division of the zygote leads to the abnormalities of the chromosomes. These abnormal chromosomes will lead to the genetic diseases. Now we have come to the third phase of our lesson, that is the types of genetic diseases. The genetic diseases are grouped into three categories. one is chromosomal anomalies, the second one is single gene disorders or Mendelian disorders, and the third one is multifactorial disorders. First, we will take up the chromosomal anomalies. The chromosomal anomalies indicates that the abnormality in the chromosome. This may be numerical anomaly or structural anomalies. The numerical anomalies is again either in the autosomes or in the sex chromosomes. If it is in the autosomes, this is called autosomal anomalies. If it is in the sex chromosomes, it is called sex chromosomal anomalies. The example for these autosomal anomalies is Down syndrome or trisomy 21. If you see the karyotype of this person, he possesses 45 autosomes plus XY or XX. This disorder is, we can see in the autosomal, these autosomes he possesses is 45 instead of normal 44. The second one is sex chromosomal anomalies. The best example for the sex chromosomal anomalies are Klinefelter syndrome and Turner syndrome. The karyotype of this Klinefelter syndrome is 44 autosomes plus XXY. The disorder we can see is in the sex chromosomal pair, that is XXY. In this person, the sex chromosomes are XXY instead of normal XY. The second example for this is Turner syndrome. The karyotype in the Turner syndrome is 44 autosomes plus XO. Here we can see the disorder in the sex chromosomes. The sex chromosomes are only one X instead of normal female XX. The second category of the disorder is single gene aberrations or Mendelian disorders. Mendelian genes can be inherited in 4 ways. One is autosomal dominant, the second one is autosomal recessive, the third one is X-linked recessive, and the fourth one is X-linked dominant. The autosomal dominant genes are manifest in the heterozygous state and are usually transmitted from one generation to the next generation. They usually affect both male and female children equally. In most cases, one of the parents are affected. The second one is autosomal recessive genes. These autosomal recessive genes are only manifest in the homozygous state, and normally SIPs are affected and parents will be the carriers. Parents do not manifest the disease and are more common in blood related marriages. The third disorder is X-linked recessive genes. These are normally only manifest in males and these are transmitted by the carrier females. The next one is X-linked dominant disorders. Only few disorders known to be inherited in an X-linked dominant manner. The affected male transmits this disease to all his daughters. The third type of genetic disorders are multifactorial disorders. These are partly by genetic due to the effect of many genes and partly by the environmental factors. The examples for these multifactorial disorders are hydrocephalus and encephalus. So far in this discussion, you have learned what are the genetic diseases, what are the chromosomes and genes, and a broad outlook of the genetic diseases. Now, I will take you to Institute of Genetic Diseases, which is the prestigious institute in Hyderabad, where the counseling, treatment and research on genetic diseases is going on. I request Dr. Kusuma Kumari, a specialist in genetic diseases, to explain you in detail about these genetic diseases with her experience with the patients.
Children with Down syndrome will have a small head with flat occiput and they have certain characteristic facial features. These are slanting of the palpebral fissures and increase in the distance between the two eyes known as hypertelorism, depressed bridge of nose and small mouth, and tongue will be always protruding, and because of the constant protrusion of the tongue they will have furrows on the tongue. Their ears will be small and low set, and their hands will be short and fingers will be short. They will show only 2 creases in the palm instead of normal 3 creases, which is known as simian crease. Children with Down syndrome will be mentally retarded and they will have hypotonia of all the limbs. The common sex chromosome abnormality in the males is Klinefelter syndrome. Usually these children will be normal when they are born, and at the time of puberty the secondary sexual characters they won't develop, and some children may show gynecomastia, that is known as enlargement of the breast, and their testes will be small. When they grow as adults, they will be sterile because the testes won't produce the sperms. When we do chromosomal analysis for these children, we see 47 XXY chromosome constitution instead of normal male constitution of 46 XY. The common sex chromosome abnormality in the females is Turner syndrome, where they will have one X chromosome missing. These children may be normal at birth, or some children will show swelling of the dorsum of the hand and feet and loose skin fold in the nape of the neck. And sometimes they will have short neck with webbing or skin folds on either side of the neck, and their stature will be small, that is as an adults they won't grow more than 145 centimeters. And at the time of puberty they won't have normal secondary sexual characters and they won't menstruate because their gonads are streaked, that is ovaries will be streaked. The common example for autosomal dominant disorder is achondroplasia. This is a type of skeletal dysplasia which occurs with a frequency of 1 in 25,000 children. These children will be short, very short in stature, and their head will be large, and they will have frontal bossing and depressed bridge of nose. Their upper arms and thighs will be short compared to the forearms and legs, and their hands will be short with fingers also very short. Their intelligence will be normal. This is a boy with phenylketonuria. This is an example of autosomal recessive disorder. These children will be normal at birth. Once they are started with milk feeds, they develop convulsions, then mental retardation and other neurological features. They will be unusually fair and their hair will be hypopigmented. These children will have persistent convulsions unless in the diet we eliminate phenylalanine. This disorder is due to an error in the metabolism of the amino acid phenylalanine due to lack of the enzyme phenylalanine hydroxylase. The main therapy is diet therapy, that is replacement of the phenylalanine in the milk. This will make them as normal children. These two siblings are having a sex-linked disorder known as Duchenne muscular dystrophy. This condition occurs 1 in 10,000 male children. Usually they will be normal at birth, but once they start walking, they frequently fall and they gradually develop difficulty in climbing the stairs and getting up from the sitting position. They will have enlargement of the calf muscles and their gait will be waddling. As the disease progresses, the weakness of the muscles also increases both in legs as well as in the hands, and they become completely bedridden by 10 years of age and they die by 20 to 25 years. This condition is known as resistant rickets, vitamin D resistant rickets. It is an X-linked dominant disorder. Here the children will develop all skeletal abnormalities, especially abnormalities of the chest as well as the long bones in the legs. They will have bow legs and deformity of the both tibia. This is due to deficiency of the vitamin D, and they need very heavy doses of vitamin D. This condition is known as hydrocephalus. It is an example for multifactorial disorders. In this condition, there will be obstruction to the flow of the cerebrospinal fluid. Because of obstruction, the head size will enlarge, and these children will be mentally retarded and they develop convulsions. This is another multifactorial disorder known as meningocele, where there is a defect in the spinal column, and the spinal column will be, there is a gap in the spinal column, and the meninges along with the spinal cord will be exposed outside. These children will have paralysis of the lower limbs and other neurological deficits.
Now you will study the last part of our lesson on genetic diseases, that is the diagnosis and management of genetic diseases. Madam, how do you diagnose the genetic diseases?
For diagnosis of genetic disease, the first step is taking detailed family history from the patient or from the parents, and we draw the family pedigree tree consisting of 3 generations. This will help us to know the mode of inheritance. The second step is clinical examination of the patient, and if necessary sometimes we have to examine the parents as well as other siblings. Then depending on the clinical features we will come to a provisional diagnosis, and then the third step is to confirm the diagnosis we do certain investigations. These include biochemical tests, cytogenetic tests, immunological studies, and sometimes DNA studies also to establish the diagnosis.
How do you manage the genetic diseases?
Management of genetic disease includes 2 parts. One is treatment of genetic disease, the second one is prevention of genetic disease. As far as treatment is concerned, the ideal treatment for genetic disease would be replacement of the missing gene or abnormal gene. This is also called as gene therapy. Lot of research is going on this field, and we hope gene therapy will become a reality in near future. And when we come to the prevention of genetic disease, there are 2 types of prevention. One is primary prevention, the second one is the secondary prevention. Primary prevention is very difficult to achieve because we should know the reasons why the mutations are occurring in the chromosomes as well as in genes, and we have to identify the factors and remove them. This is a difficult situation. Till then, what we do is secondary prevention, that is prevention of the birth of a child with a genetic problem. This can be done by genetic counseling as well as by prenatal diagnosis.
Professor P.P. Reddy, the director, will explain you the motive behind the establishment of this Institute of Genetics and Hospital of Genetic Diseases.
This is the first and unique center in the country for genetic diseases. The patients, once they come to the hospital, they visit the Department of Clinical Genetics, where our experts, where our doctors examine the patients, and also a case sheet is written, that is their name, address, the disease from which they are suffering, and also the family history, whether they are having any genetic disease in their family, and so on. So the patients are thoroughly examined in the clinical genetics department, and their samples, body fluids, that is urine, blood, are sent to different sections. We have got different departments. We have got Department of Clinical Biochemistry, we got the Department of Cell Biology, we got Department of Molecular Biology, and where these samples go there, they are sent there, and the diagnosis is made, as I told earlier, by using different techniques. Once the diagnosis is established, after this test, the diagnosis is established, and again the information is passed down to the pediatrician or the genetic counselor. As all of you are aware, prevention is better than cure. Particularly that is very true in the case of genetic diseases. Once a person is afflicted, nothing can be done for the particular patient, very little can be done. So better thing is to prevent the birth of children with such defects.
So far in this lesson on genetic diseases, you have studied about the genetic diseases, about the chromosomes and genes, and about the details of the genetic diseases. Now, I will summarize the entire lesson. Family studies are often necessary to determine the mode of inheritance of a character or trait and to give appropriate genetic counseling. Number 2, the interaction of abnormal genes and the environment leads to genetic diseases. Number 3. Genes are the units of DNA responsible for expression of characters in an organism. Number 4. The chromosome number in human beings of 46 occur in 23 pairs, one derived from each parent. Number 5. The possible error in meiosis and early cell division of the zygote leads to abnormalities in chromosomes. Number 6. Down syndrome is an autosomal numerical anomaly in which the karyotype of the child is 45 autosomes plus XX or XY. Number 7. Klinefelter syndrome is sex chromosomal anomaly in which the karyotype of the child is 44 autosomes plus XXY. Number 8. The Turner syndrome is also sex chromosomal anomaly in which the karyotype of the child is 44 autosomes plus XO. Number 9. Mendelian genes can be inherited in 4 ways: autosomal dominant, autosomal recessive, X-linked dominant and X-linked recessive. Number 10. Autosomal dominant genes are manifest in the heterozygous state and are usually transmit from one generation to the next generation. They usually affect both the male and females equally. In most cases, one of the parent are affected. Number 11. Autosomal recessive genes are only manifest in the homozygous state. Normally, SIBs are affected. Parents will be the carriers. Parents do not manifest this disease and are more common in blood-related marriages. Number 12. X-linked recessive genes are normally manifest in the males and is transmitted by the carrier females. Number 13. Only few disorders known to be inherited in an X-linked dominant manner. The affected male transmits the disease to all his daughters. Number 14. Multifactorial disorders are partly by genetic due to the effect of many genes and partly by the environmental factors.
మన ఈ ఉన్నత విద్యా కార్యక్రమాలపై మీ సందేహాలను, సలహాలను, అభిప్రాయాలను మాకు తెలియచేయండి. చిరునామా: డైరెక్టర్, ఆడియో విజువల్ ప్రొడక్షన్ అండ్ రీసెర్చ్ సెంటర్, డాక్టర్ బిఆర్ అంబేద్కర్ ఓపెన్ యూనివర్సిటీ, ప్రొఫెసర్ జి రామ్రెడ్డి మార్గ్, రోడ్ నంబర్ 46, జూబ్లీ హిల్స్, హైదరాబాద్ 500003.